Hi, I'm Will Douglas, owner of Cody Drug, and I wanted to welcome you to a space that we've created to discuss questions we hear every single day. Each month, we'll share a slightly longer conversation on topics you care about the most, so we can dig into what's shaping the compounding pharmacy industry. Today, we're lucky enough to have Dr. Casey Shelly. Casey is an anesthesiologist, a medical director, and a Cody Drug partner. So, Casey, you get to work with patients who are highly invested in their health, their performance, and their longevity. So, from your perspective, what difference do compounded medications make for your patients?
That's a really great question. I believe compounded medications are more easily tailored to an individual patient's
Sure.
needs. They are able to be more customized and not just for the sake of, being custom, but to really allow for more clinical precision. Compounding medications allows the provider to not only take into consideration a patient's lab values, but also their specific symptoms and really titrate doses based on individual patient needs and also alter the routes in which the medications are given based on what the patient needs. Also compounding medications allows you to easily remove
Hmm.
allergens and to titrate doses to reduce tolerance to certain medications, as well as to alleviate unwanted side effects. Essentially, the use of compounded medications allows for the ability to more accurately treat multiple concerns in a timely fashion.
So, where do you see the biggest impact and outcomes when you're able to prescribe compounded medications?
Well, I definitely think, like I mentioned, is the titration flexibility. It allows you to, take into consideration the patient's symptoms. You may even be able to combine therapies to reduce pill burden for patients,
Mm,
which again can really improve overall
sure.
medication compliance
Right.
and therefore patient satisfaction and better relationships with healthcare providers and pharmacists alike.
So, how does compounding help you practice medicine the way that you want to practice?
So compounding lets me practice precision medicine instead of population medicine. In longevity and hormone optimization, small adjustments matter, like the dose, the ratio, the timing, and the delivery route. Those nuances don't exist in most commercial options, but when I can really fine tune the therapy, I'm not really reacting to the side effects of the medications, I'm optimizing them for the patients, which really changes everything.
Sure.
It moves my care from good enough to designed like specifically for you, and that's how I want to practice
Right.
and how I feel it is best to treat my patients.
That's awesome. That's one of the things that we talk about a lot at Cody Drug is the importance of personalized medicine because the big box options fits a lot of people,
Sure.
but it doesn't fit everybody, right?
Right.
And those outliers, those are the ones that we care for.
Yeah, I totally agree.
So I talked about how, we at Cody Drug, we talk about personalized medicine a lot. A lot of prescribers talk about personalized medicine, but what does personalized medicine mean to you and how you practice medicine?
Well, no patient is the same, and I find that there is no one size fits all dosing. We have to take into consideration labs and symptoms. Oftentimes, a lab value does not actually reflect what a patient's symptoms are. So, in order to practice personalized medicine, we really need to use the ability of compounding medications to modify protocols over time. And really to work with a very responsive pharmacy such as yours, and again, communication with the pharmacist is essential to personalizing medicine.
That's interesting that you talk about the labs. So when you're practicing, are you more worried about getting the labs in the perfect range, or are you looking for the desired outcome with the patient, whether they're feeling better or they're losing weight or more active? What's the
Definitely the patient
okay?
outcome. I mean, we really have to stop and talk to our patients and listen to what they're saying. Because, like I said, not all lab values reflect a patient's feelings, especially, when we talk about right now. perimenopause and such, things like that, where patients may have a lot of complaints and their
Hmm.
lab values look the same,
Hmm.
or look normal. But once we try these medications and are able to tailor them to improving symptoms, we really see a difference in the patient's overall like health and well-being and happiness.
Sure. And then you talk about hormones and menopause, perimenopause. You're talking about drugs with a really small therapeutic window, right? So you have to tailor that percentage of this drug or that drug to really dial in and get those patients where they want to be and to get those labs where you want them to be as
For
well.
sure. Yeah,
Sure.
exactly.
Okay, so when you're talking about the margins and these small percentages of a drug one way or another, how important is it to have a relationship with the pharmacist and the pharmacy in general to really help get your patients dialed in?
The relationship with the pharmacist and pharmacist and the pharmacy is of utmost importance to me. I need direct access. I need to be able to speak to the pharmacist, and really, it is a collaborative effort. So I need to be able to talk to the pharmacist about, the patient's
Hmm.
symptoms or lab values, whatever I'm trying to tailor their dosage to, and also get some input from the pharmacist, get the medication adjusted in a timely manner so that we can help the patients quicker. For instance, I had a patient that was a very difficult case, and I really needed to discuss with the pharmacist exactly how we should tweak the medication and what percentages we should change in the medication. And it was really important to me that I was able to get a hold of somebody at Cody Drug in such a timely fashion and have that collaborative communication. Just really made me feel like the patient was also important to the pharmacist and to the pharmacy. And it really felt like just a collaborative effort in taking care of this patient as best as we could.
That's awesome, and that's one of the things that we pride ourselves on because some pharmacies are and pharmacists are really hard to get a hold of, and so we certainly take great pride in making ourselves available to have that collaborative approach with our prescriber partners. We're not just putting pills in bottles. We're trying to improve people's lives. So Casey, there are compounding pharmacies everywhere. What made you choose Cody Drug?
Well, I think the sterile practices at Cody Drug are just, top of the line. Number one. Number two is just consistency in product quality that is made in the pharmacy, as well as a reliable turnaround time. And then, as I said, overall responsiveness. When I need to speak to somebody, I can always get a real human on the phone in a timely manner. The person's always willing to take time to speak with me about my clinical concerns and questions and thoughts about my patients and the medications that they need. So overall, it's just been very easy to use Cody Drug as my go-to pharmacy. Really, it just has everything that I need and expect in helping me care for my patients.
We really prioritize providers and making it easy for y'all because we understand that you guys have a million things that you're doing on any given day. You've got your patients calling your office, asking your nurses where the medication is. You've got patients coming in that you're having to see. And so we really do understand that. And we want to make it things for y'all as streamlined as possible from the time a provider starts working with us that they're able to access our portal. They're able to onboard and sign up by themselves. There's no, clunky back and forth to the time they send in their first prescription. And if there's questions, we're absolutely reaching out and we're making sure we're getting medications. If we receive a prescription that day, we're going to try our damnedest to make sure it goes out that day because we understand you guys are trying to make your patients happy.
Yeah, absolutely.
And the best way we can do that is by making you guys happy. Because if y'all are happy, your patients will be happy.
Yes, I totally agree, and we really appreciate that. And again, that's why we just come back to you. I come back to you time and time again, and just have really enjoyed working with your pharmacy and all of the pharmacists that work at Cody Drug.
Well, we appreciate that. So, how has that seamless process working with Cody Drug changed your confidence level with how you prescribe?
So, like you said, you roll these prescriptions out very quickly, which has allowed for me to have fewer patient complaints, questions, callbacks. I know I'm going to get predictable outcomes in the quality of the medications, and really just increased efficiency means increased profitability overall.
How has working with Cody Drug, has that helped you to differentiate your practice and help you stand out amongst the number of prescribers and providers that are offering, similar services?
Well, it's really allowed me to offer more nuanced care. I'm able to offer advanced protocols to my patients and allow them to realize that I'm really trying to personalize their care and tailor the medications to their symptoms and to their needs. I have a higher retention of patient number, and really I'm able to tell them, that we are customizing for you. And like I mentioned earlier, not just customizing for the sake of saying it's custom, but to really have some clinical precision in their care.
All right, Casey. So if you had to describe in one sentence what having a compounding partner like Cody Drug allows you as a provider to do, what would that sentence be?
Hmm. I would say that it allows me to practice medicine the way it was meant to be practiced: individualized, precise, and fully centered around the patient. Working with Cody Drug gives me freedom. And when providers have freedom, patients get better care. It gives me the freedom to deliver care that's truly customized, and that level of precision is what sets my practice apart from others.